And the important thing is we live in a healthcare world where, it's like big deductibles, stuff like that. I have cash pricing with LabCorp. I also saw, if you go back to page 3 there, all these tests that I listed from the panel. There's 58 tests. We have a cash price of $225. Now, every one of those tests, if you decide to take it to your MD and have it run through insurance, I don't care. It's like I refer all of my diagnostics out, like Scottsdale Medical Imaging or Simon Med, you need x-rays, MRIs. I farm all that stuff out. So I gave you the codes, give it to your MD, get it run through insurance. The super important thing is fast 10 p.m. night before, try to get your blood work done first thing in the morning, and maintain your water intake. A lot of MDs will tell you to stop drinking water, and the thing is, you think what you're drinking is enough. Well, if you do that and then you come back dehydrated, then right there, part of your problem is just drinking water. And a lot of people don't drink water. And just a nice strategy, whether it's for weight loss or just really helping improve digestion patterns, is if you drink 2 8-ounce glasses about a half hour between your breakfast, lunch, and dinner, that's going to improve your digestion patterns. Okay, and then if you do 2 more glasses an hour after dinner, these are all things that keep you better hydrated. But it all goes back to, what can you do to prevent Parkinson's? Okay, it's a neurodegenerative disease, and if you start slowing down, you don't move as fast. And one of the first clinical telltale signs, and it wasn't in the 7 here, is when you walk, you should be going like this. Okay, so next time you go to the mall or grocery store, and if you see somebody that's doing this, okay, well, there's no swing in my right arm because my left basal ganglia isn't working. Okay, so what do we do to activate that? Cross crawl exercises, balance exercises, eye exercises. And you can't cookbook this stuff because what you may need for an exercise for your brain is going to be uniquely different than Barbara's. Okay, and for some people, getting adjusted is the absolute worst thing in the world. And for other people, some people can never get to tolerate a neck adjustment. Other people, it's the only thing they'll ever fix them. So that's the whole strategy of incorporating functional neurology, which is a variety. Chiropractic is just one little thing I do. It's all these other exercises that we incorporate to try to make your brain work better. And then if you really want to turbocharge it, that's where nutrition comes in. So, all right, that's about 35 minutes. So I'm open to any questions.
Do you also test for food allergies?
I don't initially. When you say the word foundational assessment, and then you talk to guys that say they do functional medicine, okay, the word foundational and functional is a lot of times what functional medicine docs do is they go after a single organ and they don't look at the whole body. And so a lot of times they miss the boat, and I'll have people that go through a lot of different allergy testing and spend thousands of dollars on that, and it didn't work. So I always like, I'm kind of simple and German, I just kind of like real analytical things, so I just kind of try this first, see if it works, okay? And depending on how abusive you have been to your body, it's going to be more expensive in the beginning. But like a lot of times it's, typically a lot of people are spending, $100, $200 a month in supplements. My dad had a heart attack in '99 July, and I probably since '99 have sent my parents probably just under 70 grand in supplements, and that's my cost. So it's like, my dad was real good about being regimen intake. My mom always had to coach her along, but I think if it was a dentist, she'd not brush her teeth. It was just something to get back at me. So, but anyway, but you see, when it comes to allergy testing, if you have allergies, you're going to pick up a lot of that from just this foundational assessment. In fact, a perfect example, myself, I grew up in a dairy farm, and I had asthma when I was a kid, and your eosinophil count, you don't really like it less than 5%. That's one of the 5 white blood cells. Mine was high as 21%, okay, and I'm of that era where back in the 70s, they thought it was great to give somebody 80 to 100 milligrams of prednisone a day for months, okay, and even when they put me on prednisone, it went down from 21%, that was as high as it was, down to 17, and I started taking an odor-free garlic formula, knocked it down 5-7%. So there's a lot of stuff you can do with nutrition, but it's you can't stick your head in the sand. Man, and the big thing is if you're going to be spending, $100, $150 a month in supplements, you want to make sure they work. So if you repeat your blood, if you repeat your blood work and it's not making a difference, then you have to try something different. And that just goes back, we factor in different things as far as genetics, and this isn't racist, but 200 years ago, the American Indian was not overweight. It's just they adapted, they have a genetic weakness, and they adapted the Western lifestyle, and that's why alcoholism and diabetes is worse, and white people don't get sickle cell anemia. Okay, so it's just there's all these little genetic things that can be influenced into our health, and if you want to try to do something to prevent all neurodegenerative disease, you don't wake up with Alzheimer's. Okay, it's just one of these things that there's some nice things you can do, as far as finding out. You can do the APOE test. Is about $150 and measures your potential to have Alzheimer's based on genetic expression. So.
I think there's a question on there.
I'm sorry.
What are some ways of managing stress, maybe for someone with a cognitive disorder? Some helpful tips?
Going back to my first 5 things here, balance exercises, eye exercises, they can be specific for cognition. There's the whole thing with most, if you're dealing with stress, that's pretty much a frontal lobe disease, or it's frontal temporal. And there's different activities, like we know your right brain, your left prefrontal cortex makes you happy. Okay, your right prefrontal cortex actually makes you sad. So like a lot of times I'll give patients that have depression or anxiety issues left frontal lobe activities. I may adjust them totally different for the sensory motor part, but for the cognition part, and that's why it's difficult to cookbook this stuff. And just like I said, that whole boom boom thing. You can, if you're not doing cocaine, then you can do this. And it's like, in fact, I just mixed up a sample, because what I just do is I got the 3 ones by themselves, and I just throw it in here, and everybody's welcome to just take a big whiff of it and see how it opens up your head. Okay, and once again too, when you're talking about stress and anxiety, if you're on that roller coaster of every morning getting up and drinking a pot of coffee and eating donuts, and that gets you to 10 o'clock, and then you're doing the same thing over again, there's really no benefit. I ain't gonna be a hypocrite, I like coffee, okay, and that's why I'm trying to use this stuff to replace it. But the big thing is your diet sodas are absolutely bad for you. Your trans fats are absolutely bad for you, and you're not going to really. You're kind of if you remember the Beverly Hills Cop with Eddie Murphy.
Yep.
Okay, remember the banana in the tailpipe?
No.
Okay, so the 2 cops were like casing him out. So what he does is he wants to escape. So what he does, he takes a banana, puts it in the tailpipe, and then when the cops try to take off, the car stalled. So the big thing is you can't take a ton of supplements and then think you can smoke, okay? And you're not going to, your chances of being better won't happen. So it's all goes back to, this stuff is not a magic pill. It's time and effort, and it's not that much time. Most of the stuff I show you takes you 10 minutes a day to do. You just got to do it.
So I have a question. If you wake up one morning and you find out that you have the beginnings of Parkinson's or Alzheimer's or anything like that, is there something that you can do to slow it or stop it or reverse it?
Well,
or is it too late?
It just depends. The big thing is what I'm talking right now. It's like, this might be an eye-opener for some people. It's like, okay, maybe I should start taking care of myself. Maybe I should start changing some of my lifestyles. If I'm saying stuff that's like, maybe I do all that stuff too much, maybe I should stop. There's actually 7 classifications. I gave you 7 symptoms, but there's 7 classifications of Parkinson's. And all I can tell you is some of the most common things are these 7 things are those first couple stages. You see somebody walking without an arm swing. That's, obviously, if I can see somebody in stage 1, 2, 3, 4, I got a much better chance of stopping that with diet, nutrition, exercise. When somebody, and Constantine Michonis is an MD friend of mine, he's 4 Peaks Neurology, practiced at 90th and Mountain View. The easiest $300 he makes is he's a specialist. So what he does is, when the primary care sends a patient to him, and he walks out to the waiting room and says, Mr. Jones, come up, and Mr. Jones, okay, you're not going to do much for that person. So these are all little signs, and it's some, you can do self-assessments. I mean, everybody's got smartphones now. I mean, if you really want to just check yourself out, watch yourself walk and see what's your gait patterns like. Okay, or do it if you make it a buddy system. I mean, you do little screenings. And like I said, if when you did this and you didn't feel anything work, okay, that just tells me you got horrible postural tone to start with, because you should feel your neck muscles contract, because your neck muscles are yoked with your eye muscles. Okay, you see, you got off your brain. Off your core, you got 31 pairs of spinal nerves, and off your brain, you got 12 cranial nerves. And cranial nerves 3, 4, and 6 all affect these eye patterns that I was just talking, as far as going side to side, up, down, diagonals. Okay, and then we were talking about the mesencephalon before, which is excitatory to everything. Well, cranial nerves 3, 5, 7, 9, and 10 all affect blood vessel tone. So if your brain doesn't work as well on the right side versus the left, then this is how you can come up with all these weird symptoms. So, some of the beginning stuff is number 7 or number 6 of where it was basically dizziness. Okay, and the way the brain works is brain is selfish. So rather than keeping up with the Joneses, bring it down to your level. So if, let's say, my left brain's not working, it's making my right side not work as well, then over time it has enough crosstalk. It says, hey, right brain, stop working as well. So do you ever see somebody like this? No, you see people like that. And that's just the chronic effects. So it just goes back to getting assessed by somebody. And then if you're on board with it, then you have to change your lifestyle.
Okay, so going back, you said Parkinson's. Is Alzheimer's and other brain disorders same thing?
No, this is the problem. Remember I said early on, Parkinson's doesn't kill you. Okay, what Parkinson's does is slows down. You see, your basal ganglia is your older motor nucleus, and your left, for example, your left affects right, and your right brain actually influences both. So the problem is when you start slowing down the motor pathways, okay, and unfortunately the original Parkinson's medications were L-dopas, okay, and the problem with an L-dopa drug is it'll probably within 7 years of taking it induce dementia. And Alzheimer's is a form of dementia, but it's a different part of your brain. Okay, all dementia is frontal lobe based. Okay, and so that's the side effect. And then it's like, so what you're trying to do is you're trying to have a medication, and that's the problem. Alzheimer's too. It's like the last 30 years they've had 200 drugs they've tried. They all fail in the last 30 years for Alzheimer's. There's not a really good fix for that either. The biggest problem with Parkinson's meds currently is they're trying to do something that's not L-dopa. So unfortunately the side effect of the newer Parkinson's drugs are obsessive compulsive disorders. So people are becoming sex addicts or gamblers. And you literally on some of these drugs now, I think it's funny, but it's sad, is you have to have power of attorney shift over to a family member because, you used to have to drive to Vegas to spend your money. Well, now people can go online gambling and lose their whole fortune in weeks. So.
Is there a simple way to tell between if a tremor is Parkinson's or nerve damage?
There's 20 different movement disorders, okay? And for the most part, if you see somebody with a shake in their arm, it's either going to be a Parkinson's or an essential tremor, okay? If you wake up with a stiff neck, that's actually one of the 20 movement disorders as well. So if you're looking for true peripheral nerve damage, is what you're asking me?
Yeah, so I know my grandfather had Parkinson's, so I know what his tremors look like, and
Right.
so whenever I see,
Right.
just curious.
Once again, the problem is your new brain is the frontal lobe, your parietal lobe, stuff like that. Your old brain is all paleocortex, and it's also called basal ganglia. And there's a lot of research that, there's always studies I'm PubMeding, but a lot of times people can have restless leg syndrome, and then 10 years later get diagnosed with Parkinson's. So a lot of times it just depends the degree of tremor. Now, again, if you drink too much coffee and you got a shake or something like that, that's an example of alcohol or caffeine, making you metabolically not working as well.